WRTV Investigates is tracking a big uptick in fraudulent billing to Medicare, also known as phantom billing. It's a problem one group says is costing taxpayers billions of dollars. WRTV Investigates' Kara Kenny is digging into how you can spot the fraud and what's being done to address it.
Ann Midkiff of Indianapolis takes her retirement seriously. But her Medicare statements, not so much.
Do I look at them all the time? Not always.
But this statement caught her eye. More than $3,000 worth of urinary catheters billed to Medicare using her Medicare number.
Not to get too personal, but have you ever used a catheter?
Not while I was conscious.
All jokes aside, Ann never ordered or used any catheters.
What is the ultimate concern for you?
Fraud.
The same thing happened to Nancy Moore.
They billed for 2 months, so, around $3,000 Medicare paid. And also my supplement paid.
Moore is the director of Indiana Senior Medicare Patrol, a project aimed at preventing healthcare fraud.
It's like a phantom billing, and everything looks good on paper.
Are you getting a lot of complaints about this?
We're getting dozens of complaints.
WRTV Investigates called the Brooklyn, New York supplier listed on Ann's Medicare statement, and we got its voicemail.
I'd like to speak with you about some of the Medicare recipients who have been billed for urinary catheters.
We have yet to hear back.
What do you say to those people that say, well, I don't have to pay anything out of pocket, so what difference does it make?
It makes a difference because we all are paying for it, whether you're working or not, or on Medicare or not.
In fact, the National Association of Accountable Care Organizations just released a report showing just how much this problem is costing us taxpayers. They're an advocacy group that represents hundreds of healthcare systems across the country. They found Medicare payments for catheters increased from $153 million in 2021 to more than $2 billion last year, most of them charged by 7 high-volume suppliers. The analysis also found 40,000 patients were billed for catheters in 2021. That number ballooned to 450,000 last year. WRTV Investigates reached out to the Centers for Medicare and Medicaid Services to find out what they're doing about this problem. A spokesperson told us CMS does not confirm or discuss the existence of any ongoing investigation to ensure we do not compromise the integrity of the investigative process. However, that does not mean actions are not being taken behind the scenes. Medicare says if you're billed for items you did not authorize, call 1-800-633-4227. That's what Nancy and Ann both did, and they received new Medicare cards and numbers.
Are you concerned that this could happen again?
Oh, absolutely. I mean, if it happened once, they're obviously finding numbers.
What's your advice to anyone that's on Medicare?
Look at your statements religiously every month. Go over them completely and be sure that everything that is listed on them is something that you actually used.
Kara Kenny, WRTV.
Senior Medicare Patrol is asking you to report phantom billing to them at 1-800-986-3505. WRTV Investigates asked Medicare for specifics on how often these fraudulent catheter charges are happening. We did not receive that information. CMS told us it is important to note that beneficiaries have no financial responsibility for paying for fraudulent claims. Now, we also reached out to several members of Congress to find out what they're doing to address phantom billing. U.S. Senator Mike Braun agreed to speak with us.
What are you doing as a senator to address this problem?
And what I've done is initiated a letter along with another senator to actually ask the General Accounting Office to look into it. They're going to. They've just scheduled an audit, so we'll at least have that to report back on. Also got legislation.
Senator Braun and Louisiana Senator Bill Cassidy's bill is called the Medicare Transaction Fraud Prevention Act. It would create a 2-year pilot oversight program at CMS targeting fraudulent billing for certain products. Medicare currently loses $60 billion a year to fraud, errors, and abuse, including phantom billing for catheters. Braun is currently working on gathering support from fellow senators. You can read responses from other lawmakers and CMS in this story on the WRTV app and at WRTV.com.